Okay, these are simple exercises for improving the range of motion of your shoulder joint. It would be for conditions like stiff shoulders, chronic inability to raise your shoulder above your arm, and similar conditions. Now, if you know that you have a rotator cuff tear that's significant in size, maybe from an MRI, it's best not to do these exercises until it's been determined that the acute phase has gone down somewhat and that you're able to actually put a load on your shoulder. So, just like in anything, if the exercises cause an increase, a significant increase in your pain, discontinue, stop, and check with your doctor. The shoulder joint, or glenohumeral joint, is the joint in the body that has the greatest, most versatile range of motion. It can move in multiple planes, and it's got a lot of moving parts, tendinous attachments, that enable it to do so. So what we see here is the humerus, which is the upper arm, the head of the humerus, and then the glenoid fossa, which is a depression in the scapula or shoulder blade. And then you have the collarbone at the top. This is called the acromion, and some supporting ligaments there. So all three of these structures work together to form the glenohumeral joint, i.e. shoulder joint. Now, some of the more common problems with shoulders are stiffness, pain, loss of mobility. And this is easy to understand once you see what the internal structures look like. This is a side view cross-section of the glenohumeral joint, and what we see here is the supraspinatus muscle and the tendon, the subacromial bursa, which is a piece of tissue that acts like a frictionless pad. It allows tendons and muscles to move over bony structures without too much difficulty. This illustrates impingement syndrome. You may hear a lot of doctors mention that term whenever the patient cannot lift her arm to the side. And what happens is that the subacromial bursa gets compressed. It bunches up and restricts the humerus from abducting further. We have tears. This is an illustration of a tear in the supraspinatus tendon. Some people, well, it's also referred to as a rotator cuff tear. The rotator cuff is basically the shell that encases the glenohumeral joint, to which the various muscles attach to. And this right here illustrates a surgical repair of the supraspinatus tendon. And the biceps tendon, or the bicipital tendon, which is not illustrated here, can also cause problems in the shoulder joint. Inclined bench. You grab a weight that's about 8 pounds to 10 pounds, and what we're going to do is allow gravity to pull the weight. I have the weight of the arm and the weight of the dumbbell to distract the glenohumeral joint. And you're going to make small circles, like so. And if you notice, I am not using my arm muscles to do this. You should not do that, because when you do that, it recruits the shoulder muscles and you will not get an effective traction. So just let the arm relax. You should feel the arm being slightly tractions out of the shoulder joint there, and rock your body in such a way that it makes the weight go in circles by itself, and it's taking the arm with it. And then shake a little bit more to make bigger circles, again letting that weight traction the arm. Stop and do a reverse, small circles first. It's kind of like the action of a hula hoop. You kind of move your hips and body and let the weight make the circle on its own. And then stop. You could also go back and forth. And then side to side. And if this causes acute pain, obviously just stop right at that moment. You're probably dealing with a more significant tear. So for this exercise, get a weight. This one is about 2 pounds. Grab it, and you're going to be raising your arm up and down like so, nice and controlled and slow. And you're going to go around in a clockwise fashion. Just like this. This would be like 4 o'clock right here. And then like this. That would be like 6 o'clock. Okay, notice that I kept my hand facing down for this one. Then you're going to turn your arm this way, thumbs up, and do the same thing about 2 times around. This is 3 o'clock. Nice and controlled. Okay. And it's hard to do this one with the 6 o'clock position. Okay. Then you could point your thumb down and do the same thing. Do it on both hands. Now, people have used TheraBands, which are tubing. It's like a large rubber band. That works also. I'm just showing you how to do them with weights. Okay, and you could do these like daily, 3 times a day. About 2 to 3 times on each angle. Now the other exercise is this one. This strengthens the rotator cuff muscles. Go up like this and down, up, rotate out, back down. And then when you're if you feel that the weight is not giving you enough challenge, get a bigger weight. You bend your shoulder up 90 degrees, rotate outwards, back down and down. So out, rotate backwards, back down.